So we're here today at Public Health England's 7th annual Cardiovascular Disease Prevention Conference. And the event today has been chaired by the amazing Dr. Sarah Jarvis. And Sarah, this is your, I think, third
yes.
event that you've chaired. And, you obviously have a commitment towards the prevention agenda, particularly around cardiovascular disease. Why do you think this is important, particularly as a GP? Why is this important?
I don't think it's ever been more important. And part of the reason for that is that we have made such great progress. But we've now reached the stage where 1 in 4 deaths in the UK is due to cardiovascular disease, and it's plateaued. There has been no reduction in the last year or two. And it looks as if things are, unless we really up our game, not going to reduce further. That's still 1 in 4 people dying of a condition which, let's be entirely honest, should be very largely preventable.
So we've been having some really interesting discussions today about those major causes of premature death, ill health, inequalities, and thinking about the behavioural, the environmental, the physiological risk factors that are driving that. And so, what's inspired you from today's event? What do you think? What do you leave kind of thinking, actually, we are making some progress in this area? And likewise, what do you think we might need to be doing more on?
I definitely think we need to tackle health inequalities. I don't think there's any doubt that many of the risk factors and indeed many of the elements of cardiovascular disease are dramatically overrepresented in people from lower socioeconomic status. What we're doing well, actually, we're building on what we've got. The title of today was Proactive, Predictive, Personalised. We now have the tools to start being really predictive. We now have simple ways of identifying AF. We now have better tools for identifying FH. And by being proactive, we can really then start to personalise it. From my perspective, personalisation is absolutely where we need to be. We need to get away from scare tactics and bring people on board. And I think that message is finally getting through.
So if colleagues want to find out more, have a look at our Health Matters material. We've got blogs, videos and resources, and do get involved in what is a really important area of preventing cardiovascular disease.
Do it.